Hi, this is Dr. Doreste with the Cranial Release Technique, and I wanted to wish you a wonderful Sunday morning. Hope you're enjoying your summer. And I was thinking about summer and the relaxed attitude that most people have because school's over, vacation time is here for most people. And if you're someone suffering with a health problem, might be a good time to go and experience CRT. If you're a practitioner and you're thinking about, well, gee, before you know it, it's September here, I'm back to the grind, might be a good time to consider learning CRT. So I just wanted to do a brief recap, a kind of easy vacation recap. As a chiropractor since 1985, I guess I've always been looking for the best thing I could do to help my patients. If I'm going to spend a few minutes with them, what can I really do to enhance their overall physiology, their functioning, their wellness, their ability to constantly adapt to an ever-changing world? And so as a chiropractor, I was very happy doing what I was doing, but I always felt that I was missing something. And I really didn't know what it was I was missing. And then I attended a lecture back in 1998, and the lecturer said something along the lines that about 80% of the nervous system resides above the atlas, or C1. So I said, wow, that's interesting. Here it is, the brain, 80% of the nervous system inside the skull, and I'm basically working from the first cervical vertebrae down, helping a lot of patients, getting great results, having fun in practice. But yet I knew I was missing something, and I didn't really know what that was, so I started to investigate different cranial techniques, which then led in 2005 to me developing and teaching the Cranial Release Technique. So again, you know, we speak to different people who watch these videos. I'm assuming you don't know much about cranial, so the skull is made of 22 separate bones, and here's a plastic model showing the different colors to represent the different bones. And over 100 years ago, another doctor discovered that these cranial bones need to move. That was Dr. Sutherland, and this is called the primary respiratory mechanism. This little bit of movement, which I'm exaggerating here just to show you, is vital for overall functioning of the brain, the nervous system, and therefore every other function that we're aware of and not aware of in the body. So as I started to experiment and as I perfected this cranial release technique, I then found that I was helping people at a much deeper level than just working on the spine. The beauty of this work is, regardless of if you're a chiropractor, if you're a massage therapist, if you're a physical therapist, if you're an acupuncturist, if you're a naturopath, if you're a holistic dentist, whatever your degree is, the beauty of this work is because it takes all of a minute to do, you could evaluate the patient's mouth, work on the tooth, work on the TMJ, apply the cranial release technique, and your dental results and overall physiology would improve if you were a dentist. As a massage therapist, the same thing. Whether you're doing whatever technique, myofascial therapy, deep tissue, sports massage, whatever it is that you're currently doing, if you would add in this 1-minute cranial release technique, it would take your results to a whole new level. In your field that you're doing, it would really separate you as a massage therapist, as an acupuncturist, as a chiropractor. But overall, you're working on the head knowing that you're affecting global physiology. You're affecting everything. Again, take a look at the website when you have some time. It's a nice, easy summer. Cranial Release cranialrelease.com is the website. Cranial Release Technique is the work. You can search for a practitioner in your area so you can get on the table and experience the work. And if you're a practitioner and you say, gee, you know, maybe I should dabble into something. Maybe there's some questions that I have as to how can I help people at a deeper level. Well, there's nothing that I have seen that will do what cranial release technique will do. And don't confuse the fact that it only takes a minute, because that's just all the time it needs to complete the technique. So what can you do in a minute? Well, you can change virtually everything from brain hemispheric balance, autonomic balance, spinal alignment, relax the muscles, relax the tissue in the body. It just goes on and on and on. It never ceases to amaze me that a patient will get on the table and complain of X, Y, and Z, and then they'll get off after a CRT and they'll say, well, gee, that does feel better, but what about this, this, and this that I didn't even tell you about, that I really wasn't even aware, but my back feels looser, my neck feels looser, that little dull headache I had is gone. I mean, whatever it happens to be, it's different for everyone. And again, if you're a practitioner, you can go to the website and click on the online training button where you can take a look there as well at some other videos that I have and the system that we have to learn CRT in the comfort of your home or office. This is Dr. Doreste with the Cranial Release Technique, wishing you a wonderful summer. See, the Blue Jays are screaming here. Wishing you a wonderful summer. Enjoy your Sunday. Take a look at the website, cranialrelease.com. I agree. Wherever I am, it's either the Parrots in Florida, the Blue Jays here in New York. Have a good day, everybody. You be well. Remember, nature knows best. Nature needs no help, just no interference. Learn CRT. Adios.